Welcome to the Whole Child Center. My name is Dr. Lawrence Rosen. I'm a pediatrician who started the Whole Child Center in 2008 to provide children and families with the highest quality, state-of-the-art, integrative, and ecologically sustainable health care. Spend a few minutes with me during this presentation, and I'll tell you what makes our center unique and how we can work together to help keep your children as healthy as they can be. At the Whole Child Center, we practice integrative primary care. We are available to you from birth through adolescence. Our goal is to be your medical home, to provide medical care that is accessible, family-centered, continuous and comprehensive, coordinated, and of course, compassionate. Primary care is, or should be, about creating wellness. I recognize that our current healthcare system prioritizes disease treatment over prevention, and while we do treat illness, we work hard at the Whole Child Center to shift the focus to a strength-based wellness model of care. Integrative medicine is the cornerstone of the Whole Child Center's philosophy. This whole child ideal, which gave us our name, is about the attainment of optimal health and well-being through a balance of mind, body, and spirit. We also do support family-centered care, wellness, and prevention, and we're deeply committed to environmental health principles. We also individualize our therapies to work with families that work best for their child, and we support relationships with other healthcare providers, including complementary and alternative medical practitioners. This collaboration and the relationships that we have with you, our families, we think are keys to keeping children healthy. Integrative medicine is also about the seamless blend of safe and effective conventional and complementary therapies. We have this poster hanging in each of our exam rooms to encourage you to talk with us about all of the therapies and remedies that your child is using. We feel that the poster encourages an open dialogue so that there's no judgment and we can really explore what is most safe and effective for you and your family. We recognize at the Whole Child Center that many of our families are increasingly interested in nutritional supplements, herbal and homeopathic medicines, and natural body care products, but they also want to know what is safe and effective for my child. In fact, that's one of the reasons I wrote the book Treatment Alternatives for Children with Jeff Cohen, a dad in our practice. The book covers evidence-based practices so that we can help work together to discover what is most safe and effective for you and your family. We also carry many of these products at the center, so ask us about them so that we can educate you about which of these products we feel are most safe and effective. The Whole Child Center is a green medical office. What this means is that we are ecologically sustainable. We recognize not only that the environment has an impact on our children's health, but that our practice of healthcare has an impact on the environment. We built the Whole Child Center using ecologically sustainable principles, both in terms of the design and operation. Here you can see two examples from the Whole Child Center of ecologically sustainable design. On the left is one of our two waiting rooms. The furniture is made from recycled and recyclable materials. The paint, the ceiling tiles, and the flooring are made of materials that are the least harmful to the environment that we could choose. On the right, you'll see one of our two exam rooms. The exam tables we had specially made are also made of materials that are the least likely to off-gas harmful materials into the environment, and we can bring in tons of natural light, which reduce the use of artificial lighting. We believe we've created spaces that are healthiest for the humans that inhabit them as well as the environment. I'm very passionate about the use of technologies to improve communication with our patients. This high-tech, high-touch approach works to improve what we call patient-centered care. For example, we work with Athena Health to provide a patient portal, a secure communication center for you to reach us when you need to and to provide tools online that complement the work we do in our center. We also believe in the use of social media like Facebook and Twitter to improve communication with patients. We have an active Facebook site, and in the past we've used it to communicate about educational events, share recipes, and even gather goods for needy families. We encourage you to become an active participant on our Facebook page so that we can work together to create this virtual community that supports the work we're all doing in our communities to help keep children healthy and safe. We recognize that many of you have specific questions, and while this presentation can't cover everything, there are some frequently asked questions we can address. In the hospital, We do support the use of injectable vitamin K and routine newborn and hearing screening. Hepatitis B vaccination can often be waived in the case where the mother has tested negative for hepatitis B, and the use of routine erythromycin eye ointment for newborns can also be waived in many cases. Please discuss these procedures with your prenatal and hospital healthcare providers. If you've had a hospital birth, we recommend you contact us as soon as you know you're going home with your baby so that we can set up a visit within 2 to 3 days of discharge. If you've had a home birth, we actually like to see the babies within 24 to 48 hours of birth. Many of you have questions about specific vitamins and supplements like vitamin D, essential fatty acids like fish oils, and probiotics during the newborn period. We will discuss these with you at your first visit. The most common questions we get are about a topic that is perhaps the most controversial in pediatrics: immunizations. While we are pro-vaccine and support the use of immunizations as a public health policy in general, we do recognize that more and more families have concerns and questions about immunizations. We look forward to discussing with you in an open and honest informed consent review the concerns you have about vaccinations so that we can work together to develop a plan that works best for you and your family. As you can see throughout this presentation, I've highlighted the importance of partnership, working together with you to help your children be as healthy as they can be. We look forward to working with you. For more information, you can visit our website at wholechildcenter.org or our Facebook page at facebook.com/thewholechild. You can also contact us directly at info@wholechildcenter.org or by phone at 201-634-1600. We wish you good health. Have a great day.